Hospital-acquired infections have become a major concern in healthcare facilities. The main reason for this is the high cost associated with treating these infections. Patients who contract these infections tend to stay in the hospital for longer periods, leading to a significant increase in medical expenses. Additionally, the microbes responsible for these infections are often resistant to multiple drugs, which can require the use of more expensive and specialized treatment options. The chapter on nosocomial infections in StatPearls 2023 defines these infections as those that are acquired during the process of receiving healthcare but were not present during the time of admission. These infections can occur in various healthcare delivery areas, such as hospitals, long-term care facilities, and ambulatory settings, and may even develop after discharge. Occupational infections that may affect staff are also considered part of these healthcare-associated infections, HAIs. According to some sources, nosocomial infections are defined as infections that occur after 48 hours of hospitalization. The World Health Organization, WHO, reported that out of every 100 patients in acute care hospitals, 7 in high-income countries and 15 in low- to middle-income countries, LMIC, will acquire at least one healthcare-associated infection, HAI. Shockingly, 1 in 10 of those affected patients may die as a result of the HAI. Recent studies have found that patients in the surgical intensive care unit have a greater likelihood of developing nosocomial infections compared to those in other hospital wards. In contrast, only 6% of patients in hospital wards develop infections, while surgical intensive care unit patients face an overall risk of 18%. Types of healthcare-associated infections. The CDC classifies the healthcare-associated infections as follows: central line-associated bloodstream infection, CLASI, catheter-associated urinary tract infections, CAI, surgical site infection, SSI, ventilator-associated pneumonia, VAP. Let us talk about central line bloodstream infection, CLABSI. To put it briefly, CLABSI happens when bacteria or other germs enter a patient's central line and subsequently their bloodstream. Central lines refer to catheters that access large veins, such as those in the neck, chest, arms, or groin. These catheters are usually utilized to draw blood or administer fluids and medications to critically ill patients. Depending on the patient's medical needs, the line can stay in place for several weeks or months. Nonetheless, there is a risk of infection if bacteria or other germs enter the patient's bloodstream through the central line. Different mechanisms of central line infection. Infections can occur through various means. Early infections can stem from the skin. This can happen during line insertion. There may be gradual infection, starting from where the catheter exits the skin. Later infections may arise from the catheter hub or luminal surface. Preventing central line-associated bloodstream infections using the CLABSI bundle. The CLABSI bundle is a collection of evidence-based practices that are implemented to avoid CLABSIs. The bundle contains 4 measures, which include selecting an appropriate site, exploring alternative sites, using sterile techniques during line placement, and daily monitoring of lines for any problems. Now let us briefly explore catheter-associated urinary tract infections. Prolonged use of urinary catheters is a significant risk factor for developing catheter-associated urinary tract infections. According to the World Health Organization, WHO, 7 out of every 100 patients in high-income countries and 15 out of every 100 patients in low to middle-income countries will contract at least one healthcare-associated infection, HAI, during their stay in acute care hospitals. How does catheter-associated UTIs occur? Briefly, this is how it happens. The urethra becomes contaminated with rectal flora. Then these microbes migrate to the bladder. They then adhere and colonize the bladder. Invasion of the bladder is then mediated by pili and adhesins. The role of the urinary catheter is urinary drainage. However, it can also be disadvantageous in that it provides a channel for rectal and periurethral microbe ascension into the bladder, where they may cause infection. If we compare natural voiding and catheter drainage, catheters bypass the urethral sphincters. As such, turbulence associated with normal voiding is reduced. Also, catheters may cause irritation of the uroepithelium, making it susceptible to bacterial adhesion and entry. The key to preventing catheter-associated infections lies in aseptic insertion. For a comprehensive outline of the necessary steps involved in aseptic insertion, refer to the CDC table on this page. In this section, we will delve into the third type of nosocomial infection, namely surgical site infections, SSIs. An SSI is an infection that develops in the part of the body where surgery was performed. These infections can be superficial, affecting the skin, or more severe, involving deeper tissues, organs, or implanted materials. Identifying the causes and risk factors of surgical site infections. Surgical site infections are typically caused by bacteria. Several forms of contact can introduce microorganisms into a surgical wound, such as through the touch of an infected healthcare worker or a contaminated surgical instrument, airborne microbes, or microbes already present in the body that spread to the wound. Preventing surgical site infections, the top measures to take. Here are some of the most important ones to consider. Preoperative measures include steps such as bathing the patient with antiseptic soap, shaving the hair at the surgical site, and administering antibiotics before surgery. Intraoperative measures use sterile surgical instruments and techniques and keep the surgical site clean. Postoperative measures monitor the surgical site for any signs of infection. The final type of nosocomial infection we will be exploring is ventilator-associated pneumonia. Ventilator-associated pneumonia is a critical lung infection that typically affects patients who require a ventilator machine to breathe. The ventilation process involves delivering oxygen through a tube that is inserted through the nose, mouth, or neck, which can inadvertently expose the lungs to harmful bacteria. Preventing VAP. To ensure that the delivery of evidence-based practices is consistent, healthcare professionals use bundles of care. These bundles have become popular in the ICU, where they are applied to prevent VAP and provide the best possible patient care. They include elevating head of bed to 30 to 45 degrees to prevent aspiration, oral care using chlorhexidine mouthwash, prophylaxis for peptic ulcer disease, deep venous thrombosis prevention, daily sedation, and spontaneous breathing trials. To conclude, nosocomial infections not only prolong the length of stay, but also increase the cost of care. However, preventing these infections can be achieved by following some basic principles. These include avoiding the use of unnecessary invasive procedures, complying with aseptic and antiseptic procedures during daily medical activities, discontinuing invasive devices as soon as they are no longer needed, and adhering to proper hand hygiene techniques. As always, thank you for tuning in. If you found this video helpful, please don't forget to like and subscribe for more content.